Hi everyone. I'm going to go over Chapter 18, Neuromuscular Diseases, and I just have a handout here and a couple pictures. I can just do this. That you can go ahead and print up, and then you can see I'm going to talk about the myasthenia gravis, multiple sclerosis, ALS, and Huntington's, and I kind of break it down into these categories over here in the first column. Talk a little bit about the disease, the defining characteristics, what the cause, incident, clinical manifestations, and treatment. And then I have a little picture down here of all of them that you can kind of take notes with if you want. But so, I mean, there's just some important things you need to know about all of them just to be able to discern if you see a question on it, or obviously if you see a patient with it. And let's start with the first one right here, myasthenia gravis. And a little bit about the diseases just in general before I start with myasthenia. But MG is a chronic autoimmune disorder. Multiple sclerosis, debilitating autoimmune. ALS, a little different, rapidly progressing fatal disease, okay, not autoimmune. Huntington's disease, a genetic disorder, which is something that's passed on. So those are kind of some things to think about in regard to the differences between them. So let's go ahead and start with MG, chronic autoimmune disorder resulting in the reduction of the number of acetylcholine receptor sites at the neuromuscular junction. And due to the fact that acetylcholine can't attach itself because of decreased receptor sites, prevents muscle contraction. Okay, that's what would happen. Some defining characteristics: hallmark, muscle weakness that increases during periods of activity and improves after periods of rest. So it has remissions and exacerbation. Multiple sclerosis, which is autoimmune, also has remissions and exacerbations. So it's just some kind of common things between those two. Cause, don't know, don't know, don't know, maybe genetics. And Huntington's disease, it is genetic. So a little difference there with the causes. These two are unknown. Incidence affects 2.5 million people in the United States every year, predominant age 20 to 40. Really important to kind of recognize that in regard to who gets myasthenia gravis, because generally people outside this age range don't have it. Predominant age range 20 to 40. So, you know, it's likely a 60-year-old, 70-year-old woman coming in with some muscle weakness probably doesn't have myasthenia gravis. That's why this isn't, excuse me, the prevalence is important to kind of keep in mind who gets these diseases. I'm not saying men can't get them, but predominantly in women. And honestly, anyone that I have seen with myasthenia gravis, I'm not saying that there aren't men, but they are predominantly women. Factors that worsen and cause a crisis: fatigue, illness, stress, and extreme heat. So these types of things that go on, fatigues, they get ill, they get stressed out, and extreme heat can cause them to have a crisis or an exacerbation. Here's something important right here. This is a classic certification question. Most cases, the first symptom is weakness of the eye muscles. Okay, weakness of the eye muscles, difficulty in swallowing and slurred speech. And here's what we see: ptosis, diplopia, unstable gait, a change in facial expression, progressing to weakness in the arms and the legs, which could progress into respiratory difficulty. But generally, our first presentation is this weakness of the eye muscle and just kind of a relaxed side of the face in general right there. Change in facial expression. No cure, no cure, no cure, no cure. Medications that can help slow progression, some nutrition, any type of assisted devices. So just kind of symptomatic treatment. And so myasthenia gravis, this picture I have here are some symptoms. And remember, we talked about the first noticeable symptom is the weakness of the eye muscles. So we tend to see this droopiness of the side of the face. This is smooth up here. The wrinkles are gone. eyebrow is lower, can have this ptosis right here. So it's a classic myasthenia gravis sign, drooping of the corner of the mouth. Muscles that control the eye and eyelid movement, facial expressions, chewing, talking, swallowing, those muscles all become weaker. The muscles that control the breathing in the neck and limb movements can also be affected. So that's if it progresses. It doesn't always progress. So the second one is multiple sclerosis, a debilitating autoimmune disorder involving a progressive and irreversible demyelinization of brain, spinal cord, and cranial nerves. So let me just kind of go down to this picture right here. So this is a girl with multiple sclerosis, some symptoms, and this picture right here, if you remember, is the healthy neuron, and it has this myelin sheath. So we have the axon right here, and around these cells, nerve cells, is this myelin sheath, just like an electric cord that you plug in. There's wires and inside of here, but there's rubber kind of plastic around it, and that's allows this impulse to travel uninterrupted to the neuron and then it innervates the muscle, and then they are able to use their muscle. But in a damaged neuron, because of scarring and this autoimmune disorder that just beats up on this neuron, the neuron here gets exposed. You can see the myelin degenerating here. So the signal gets interrupted, and so the nerve doesn't innervate the muscle very well, and then they can have some muscular problems right here. You could see any of these organs can be affected. So vision, brain, speech, spinal cord, senses, muscles, urinary system, anything that has a nerve that innervates the muscle, right? Anything can be affected. So the defining characteristics, the body's immune system attacks the myelin, which is a nerve insulator that serves as a nerve insulator and transmits impulses. Impulses delayed, again, remissions and exacerbations. So this is just kind of an explanation of the picture I just showed you. Not sure why they have it. Greatest incidence is in young adults age 20 to 50 years. Again, it's just that young to middle-aged white women. This is much more common in white women. If you know anybody with multiple sclerosis, you may see that to be true. Living in temperate zones in certain parts of the country. Some other clinical manifestations: fever, hot baths, sun exposure, so heat, getting overheated, and always stress. Any type of stress situation, right, is always going to trigger or worsen these episodes. So heat, stress puts them in an exacerbation. Numbness or weakness in the legs and the trunk could progress to all the limbs, right? Think about the pathophysiology of the disease depending on what muscles, what nerves are being affected and which muscles they innervate. Partial and complete loss of vision, we saw in that picture, double or blurred vision. They can have visual problems. This tingling or pain, any type of nerve pain, nerve sensation, electric shock sensation that occurs with movements, right? That nerve is exposed. Tremor, lack of coordination, slurred speech, fatigue, dizziness, bowel, bladder problems if the bladder muscle is affected. So any neurological symptom can be in this box right here. Treatment, no cure. Keep cool. Remember this. This is important and specific to this one. Heat exacerbates it. Certainly devices, physical therapy, occupational therapy. Okay, the third one, amyotrophic lateral sclerosis. You know it as ALS or Lou Gehrig's disease. Rapidly progressing. This is rough to have. Fatal disease. Okay, it's going to end up being fatal. This is going to kill them. Women can live with MG or MS for many, many years. Attacks the nerve cells responsible for controlling voluntary muscles. Defining characteristic, motor neuron disease, gradual degeneration and death of motor neurons. So the nerves eventually, they just stop sending signals to the muscles. Well, these ones interrupt, right? This has an interruption of the signal. This has the acetylcholine neuromuscular junction, so muscle contraction gets affected. But now the nerve is just going to stop sending signals to the muscle. Not sure. We believe it could be something that is passed on via genetics. Most common neuromuscular disease worldwide, not necessarily America. All races and ethnicities are affected, and in this one, men more than women. So again, this can be really anybody. Early symptoms include cramps, spasticity, muscle weakness, slurred speech. Again, neurologic, right? Why wouldn't they have neurologic problems? Difficulty swallowing, chewing, paralysis. It progresses rapidly, and then the diaphragm and the intercostal muscles become affected, and these people end up on ventilators because they don't have the ability to innervate those muscles that allow for taking deep breaths. Symptoms frequently begin in the upper and lower extremities and then spread to other parts of the body and progress to paralyzation. So they will progress to being paralyzed. Eventually, it affects chewing, swallowing, speaking, and then again, right here, breathing is affected here. And that's why this is fatal. No cure. There's some medications for symptom management, physical and occupational therapy. And this is just a picture, kind of like, just a little bit of things that happen. Remember the cramping, the muscle cramp starts. They get some weakness in their extremities. Slurred speech they have because of the muscle weakness in the legs, difficulty walking. They can be tripping and falling because the muscles that are affected in the throat for swallowing is excessive swallowing. Again, any neurologic symptom. And they progress into having to be in a wheelchair and having to, again, be on a ventilator. This is a healthy motor neuron, the normal nerve innervating the muscle that tells the muscle contract, relax, contract, relax. And this is an ALS nerve, the affected nerve. And you can see how this nerve is not even innervating, not even attached to the muscle right here. There's no innervation. And because of that, you can see this neuron, or excuse me, this muscle has atrophied as well. And that's they end up in a wheelchair and their legs are become atrophied and their extremities become atrophied. And it's rough. It's just rough to see. The last one, Huntington's disease, a little different. It's a little different now than what we just talked about as far as a nerve. Genetic disorder causing degeneration of neurons in certain areas to the brain leads to progressive atrophy of the brain. Okay, so the neurons degenerate in the brain. Has a broad impact on a person's functional ability and usually results in three main things right here: movement, thinking, and psychiatric disorders. We know that it's genetic, but it's not common. It affects less than 200,000 people a year in the US. So the three main areas that we see as the patient manifests, they have uncontrolled movements, jerking, impaired gait, those types of things, those just extremities. Number two, thinking is affected, loss of intellectual faculties. They have cognitive decline. They forget, their memory is going away. So the movements and the cognitive decline. The third one is psychiatric disorders or like emotional disturbances. They may be sad, irritated, fatigued, insomniac, suicide thoughts, difficulty with speech, which can really go underneath the uncontrolled movement. So these are three main areas of clinical manifestations. Oh, and this is just kind of a picture of this. Sorry, this is a little small, isn't it? Common symptoms, again, the cognitive decline right here, some mood swings, behavioral changes, speech difficulties, involuntary movement. So again, these are just things that occur that fall into all three of these categories right here. No cure, maybe some medication to slow progression. And the last picture right here, what to know about Huntington's disease. Sorry, so I can show you a little better, hard to see. Degenerates nerve cells in the brain areas responsible for movement and thinking. It's a rare condition and we know it's inherited. Has a 50% risk of being passed down to every offspring with someone with the disease. It's expected in half of the siblings of a parent with a disease, which obviously correlates with this 50% right here. Onset of age, generally between 30 and 50. And it also is a juvenile form, so it actually can manifest in a younger child, but generally a young adult. Okay, so those are just kind of some, I'd say, main points that are important to know about those diseases, just in regard to learning basics about those. So